Principles of gas laws within the pre-hospital setting. Medical gases are an integral part of ambulance services, which are intended for administration of the following medical gases in the treatment: management, diagnostic, evaluation, and care of the patient, which include oxygen, air, and Entonox. They are supplied to the patients either through the medical gas pipeline system, via flow meter device, which helps control the measurement of air or oxygen flow, which is administered to patients, through the terminal providing hospital ward gas equipment out in the pre-hospital setting, following a regulator which provides a stable flow, independent of the pressure in the medical central gas system or cylinder. Some vehicles may be equipped with a suction ejector, which is used for suction utilizing gas where a vacuum is not available. We then have the rail system that is used for fastening the medical gas devices. Each vehicle should be equipped with smaller oxygen cylinders that can be taken to the patients if needed, and should include a cylinder valve with integrated pressure regulator for safe use. This high-pressure regulator helps regulate flow of pressure of the medical gas, whereas some gases such as Entonox have a demand valve for self-administration. Boyle's law. A gas is a substance that is in its gaseous phase, where they assume the shape of their container, where particles separate from one another moving in straight lines and in a random nature, where they only change direction after colliding with each other or the container. Pressure is defined as the force per unit area acting at right angles to the surface under consideration. As the pressure on the weight placed on the container increases, the volume which the gas occupies decreases until the pressure of the gas equals the external pressure. Charles' law. This is a measure of the average kinetic energy in a system and translates to the degree of hotness or coldness of that system. As the temperature of the gas increases, the volume that the gas occupies also increases. This means volume is directly proportional to the temperature of the gas. Poynting effect. Liquid particles have a definite volume where they assume the shape of the container, where they are closely spaced, where their motion is random but more limited. As the Entonox pressure increases, the gas will begin to partially liquidize. The particles will slip past and collide. When two gases, one of high and the other of low critical temperature, are mixed in a container, such as oxygen and nitrous oxide, the critical temperature of the gas with the higher value is lowered, pseudo-critical temp, and the mixture will remain gaseous above the pseudo-critical temperature. In cold climates, if the temperature is less than -6 degrees, then nitrous oxide will separate into its liquid form and will remain in the bottom of the cylinder, and the patient will only get oxygen initially, which will not produce any analgesia. This is why the cylinder should be thoroughly shaken before use to mix the gases. Subscribe to the channel for more.